Hello and welcome. I'm actually a medical graduate and wanted to share some part of the medical sciences and the knowledge that God Almighty has gifted upon me. So let's start with it. Now let's start with the anatomy. That is the basic study in medical sciences of the structures and positions of the structures within the body. Each term is used to orient the first structure or feature with respect to the other. The first one is anterior, which actually means in front of anything or being more front than the other, while posterior means towards the back or back as compared to the other structure of the body. A structure that is anterior to the another is closer to the front of the body, while a feature that is posterior to another is closer to the back of the body as compared to the other structures. Now, superficial means closer to the surface, and deep means farthest to the surface. The example can be the skin is superficial as compared to the lungs. Cephalic means closer to the head, while caudal means closer to the tail. Now, the example for this can be like position of the eye is cephalic as compared to the nose. At the same time, nose is caudal as compared to the eyes. This is with regards to their location in the body. Now, superior means higher or above as compared to the other structure, and inferior means below or lower as compared to the other structure along the long axis of the body. Now, the example for this is my hand is superior as compared to the feet with the location in the body, while feet are inferior as compared to the hands as compared to the location in the body. Now, superior or cranial means towards the head end of the body, and other way it can be said that position nearest to the head end of the body is known as superior or cranial. So, example can be that hand is a part of superior extremity as compared to the feet. Inferior or caudal means that location is farthest away from the head. The example can be foot is an inferior extremity as compared to the hands. Now, anterior or ventral means the front end or front side of the body. The example can be that kneecap is located on the anterior side of the leg, or eyes are anterior to the brain. Now, posterior or dorsal means the back side of the body. For example, the shoulder blades are located on the posterior side of the body as compared to the trunk of the body. Now, medial means that is more closer towards the midline of the body. The example can be that toe of the foot is located at the medial side of the foot. Now, lateral means farthest away from the midline of the body. The example is little toe is located at the lateral side of the foot, or the hand is a lateral as compared to the shoulder, as compared to the location is concerned. Proximal means towards or nearest to the trunk. Or, for example, my shoulder is proximal as compared to my hand, and my thumb is proximal as compared to the smallest fingers of the same hand. Distal means away or farthest from the trunk. The example is hand is located at the distal end of the forearm, where we can also say that shoulder is proximal while the hand is distal in its location. Now, ventral means equivalent of belly side or the back of the body, or dorsal ventral also means dorsal or the belly side or the back side of the body in the anatomical position. Now, the same way we say the dorsum of the tongue. It is actually the floor of the tongue we are talking about. Cephalic caudal means closer to the head, and closer to the head side means the cephalic, while the caudal means towards the tail or towards the bottom. Now, in this we can say that the face is cephalic as compared to the abdomen or the belly of the body, while belly is caudal as compared to the face of the body. Now let's start with the cavities or the spaces of the body. They actually contain the internal organs of the viscera. The two main cavities are called the ventral and dorsal cavities. The ventral is the larger cavity and subdivided into two thoracic and abdominopelvic cavities by the diaphragm, which is actually a dome-shaped respiratory muscle. The thoracic cavity is actually the upper ventral chest cavity that contains the heart, lungs, trachea, esophagus, large blood vessels, and the nerves. The thoracic cavity is bound laterally on the sides by the ribs, which is actually covered by the costal pleura, and the diaphragm actually is present caudally, which is actually covered by the diaphragmatic pleura. Then comes the lower part of the ventral abdominopelvic cavity, which can be further subdivided into two portions, which is abdominal portion and the pelvic portion. The abdominal cavity contains most of the gastrointestinal tract as well as the kidneys and the adrenal glands. The abdominal cavity is bounded cranially on the top by the diaphragm, laterally on the sides by the body wall, caudally from the bottom by the pelvic cavity. Now, the pelvic cavity contains most of the urinogenital system as well as the rectum. The pelvic cavity is bounded cranially on the top by the abdominal cavity, dorsally on the back or the downwards by the sacrum, and laterally on the sides by the pelvis. In combination, the two pelvic and abdominal cavities are also called abdominopelvic cavities. The smaller of the two main cavities is also called the dorsal cavity. As its name implies, it contains the organs lying more posterior in the body. The dorsal cavity again can be divided into two portions. The upper portion or the head and side of the cranial cavity, which houses the brain, and the lower portion or the vertebral canal, which actually houses the spinal cord. And the other cavity is the cranial cavity, as the name implies, occupies the brain and is enclosed by the skull bones, while the spinal cavity, similar to its name, is occupied by the spinal cord and enclosed by the vertebral column making up the backbone. The spinal cavity is continuous in continuation with the cranial cavity with the brain. Now let's start with the planes and axes of the body. All body movements that happen do occur in different planes and axes of the same body. A plane is an imaginary flat surface running through our body, while the axis is an imaginary line at the right angles to the plane about which the body rotates or spins. Now, a sagittal plane, also known as the longitudinal plane, is perpendicular to the ground and divides body into left and right. The mid-sagittal or median plane is the midline, that is, it would pass through the middle structures, example navel and spine, and all other sagittal planes. It is also referred to as parasagittal planes, or parallel to it are called parasagittal planes. The median can also refer to as mid-sagittal plane of the other structures such as digit. Coronal or frontal plane is perpendicular to the ground, and it divides the body into front end and the back end, or in other words, we can say in the ventral portion or the dorsal portion of the body. A transverse plane is parallel to the ground. It is also known as an axial plane. It divides the body into head end or cranial end and the tail end or the bottom end of the body. It is parallel to the ground, and in humans separates superior from inferior, or put in another way, head and the feet of the body. We'll be ending this section here. My apologies if there are any mistakes in it. Do like and subscribe if you get to follow the things I've tried to put forward. Thank you.